Bismillahirrahmanirrahim. Welcome to my channel Science of Life with Dr. Mohammad Yusuf. Today we are going to start the discussion of cardiac output and its regulation we are going to see. And probably we will have to cover this topic in at least 2 lectures. So first lecture is today. But before we can start, as per my routine, one ayah from Holy Quran. This is an ayah from Surah Al-Hujurat, ayah number 13. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Ya ayyuhan nasu inna khalaqnakum min dhakarin wa unsa وجعلناكم شعوبا وقبائل لتعارفوا إن أكرمكم عند الله أتقاكم إن الله عليم خبيर. या अय्युन्नास, ए सारे के सारे इंसानों, ए सारे लोगों, इन्ना खलकनाकुम, बेशक हमने तुमको पैदा किया है, मिन ज़करिन व उनसा, एक मर्द और एक औरत से, वजअलनाकुम, फिर हमने तुम्हें बना दिया, कर दिया, शुऊबम व कबाइल, ग्रोह में और कबीलों में, किस लिए? लितारफू, ताकि तुम्हारी पहचान हो सके, तारुफ हो सके. ये कबीले, ग्रोह और मुख्तलिफ जो फैमिलीज हैं, दिस इज़ फॉर तारुफ ओनली. ये सिर्फ तारुफ के लिए हैं, ये कोई फजीलत के लिए नहीं है कि कौन सा कबीला, कौन सा ग्रोह ज़्यादा अफजल है. नो, अल्लाह पाक आगे फरमा रहे हैं, इन्ना अकरमकुम, बेशक तुम में से ज़्यादा इज़्ज़त वाला, इंदल्लाह, अल्लाह के नज़दीक कौन है? अतकाकुम, जो तकवा में ज़्यादा है. तकवे की बुनियाद पर, अल्लाह से डरने और ठीक आमाल के हिसाब से उसकी इज़्ज़त है. इन्ना अकरमकुम इंदल्लाहि अतकाकुम, तुम में से ज़्यादा तकवे वाला जो है वही अल्लाह के नज़दीक ज़्यादा इज़्ज़त वाला है. इन्नल्लाह अलीमुन खबीर, और अल्लाह खूब जानने वाला और खूब खबर रखने वाला है. तर्जमा ठीक वाला देख लें. ऐ लोगों, हमने तुमको एक मर्द और एक औरत से पैदा किया है, हमने तुमको ग्रोह कबीलों में तकसीम कर दिया है ताकि तुम एक दूसरे को पहचान सको, तारुफ के लिए. बेशक तुम में अल्लाह के यहाँ सबसे ज़्यादा इज़्ज़त वाला वो है जो तुम में से ज़्यादा तकवा वाला है. बेशक अल्लाह खूब जानने वाला और पूरी तरह बाखबर है. अल्लाह पाक हमें इस बात की समझ दे और इसके मुताबिक अमल करने की तौफीक दे. हम किसी को ऊंचा बड़ा इस लिहाज से माने कि जो अल्लाह के नज़दीक ऊंचा है वो ऊंचा है, वरना और कोई ऊंचाई और इज़्ज़त का पहचान इस्लाम में नहीं है. इस्लाम में इज़्ज़त का जो बात है वो सिर्फ अल्लाह के नज़दीक तकवे की बात है. अल्हम्दुलिल्लाह. So we are going to talk about the cardiac output. Before a few definitions, we'll see what is cardiac output. We have defined it several times. Cardiac output is the volume of the blood pumped into aorta, or volume of the blood pumped into the pulmonary trunk. Both are equal. So we can say volume of the blood pumped by each ventricle is the cardiac output. And the venous return, all the blood which is being returned to the right atrium through all the venous system in inferior and superior vena cava, the venous return volume of the blood flowing into the right atrium from the veins. That is, and we have discussed it, that is Frank Starling's law. When we were talking about the properties of cardiac muscle, Frank Starling's law states that is cardiac output is always equal to venous return within physiological limits. So both are equal. So cardiac index, another term. It is the cardiac output per square meter of the body surface area. Per square meter of the body surface area, cardiac output, this will be cardiac index. We are going to see the values on next slide. Cardiac output is normal. We have several times we have discussed it. It is 5 liters per minute. Venous return is also 5 liters per minute. Frank Starling's law says venous return, all the venous return is pumped by the heart, cardiac output. Body surface area in a normal person is about 1.7 square meters, and if we divide the cardiac output by this 1.7 square meter, we will find the cardiac index. So it is 5 liters divided by 1.7. This will be equal to about 3 liters per minute per square meter is the cardiac index. The normal physiological variations in the cardiac output, they do occur. That is, for example, whenever basal metabolic rate, due to any reason, if the metabolism throughout the body increases, basal metabolic rate increases, and this will increase the cardiac output. We increase metabolism needs more blood flow. So cardiac output is always adjusted according to the requirement. So cardiac output is definitely going to increase if there is more basal metabolic rate, any condition. So level of the physical activity, that also affects the metabolism as well. Exercise, for example, that will increase the oxygen consumption, nutrient consumption, and the level of physical activity, increase exercise will cause the increased cardiac output as well. And with the advancing age, there is a reduction. This is physiological. All these are physiological changes, physiological variation in the cardiac output. With the advancing age, increasing age, cardiac output gradually is reduced. We are going to see a graph effects of age. And the size of the body. If a person is 6.5 feet tall and another person 5 feet tall, total surface area and size of the body differs. So larger size will require more blood flow. So cardiac output is more in the person who have got the large body size. So increased size will also increase the cardiac output because the requirement will be more. Now, this graph is showing you the effect of age on the cardiac output. That is about 20, it is about 5 liter cardiac output in the young people. But with the advancing age, cardiac output is being reduced. At 70, it is only 3 liters is left. So cardiac output with the advancing age, it is reduced. With the advancing age, with the weakening of the system, with the weakening of the control, with the weakening of the heart, all will contribute to this. And with the decreasing metabolism as well, changes level of the hormone and changing level of the metabolism in the people, and physical activity with the advancing age, all will affect the and it will cause the reduction in cardiac output with the advancing age. Now, control of this cardiac output. Venous return is the primarily responsible for the control of cardiac output. Of course, pumping effectiveness of the heart does contribute toward the control of the cardiac output, but more important factor for the regulation of cardiac output is the venous return, peripheral factors. So venous return is more important for the regulation of cardiac output than the heart's activity itself. Heart's activity, we have talked about, it is the intrinsic ability of the heart to pump all the venous return. It is the basic property of the cardiac muscle, Frank Starling's law, the mechanism of which we discussed when we were discussing the properties of cardiac muscle. Frank Starling mechanism, we had discussed it, but briefly. Stretch of the cardiac muscle, initial length of the muscle fiber before the onset of the contraction determine the force of the contraction. More the initial length before the contraction, more will be the force of the contraction. So when the more filling will occur, more venous return will cause stretch of the cardiac muscle, and that will increase the force of the contraction, that will increase the cardiac output. And stretch of the SA nodal, right atrium is being filled by the more venous return. SA nodal fibers are stretched, and when they are stretched, their firing rate is also increased. So there is increased heart rate by direct stretch of the right atrial muscle fibers or the SA nodal fibers, and they will fire at a faster rate, so heart rate will be increased. Plus, we have talked about the Bain-Bridge reflex. When there is more venous return, there is a reflex which is known as Bain-Bridge reflex that increases the heart rate. So all this will lead to increased cardiac output when venous return is increased. Now, venous return, what is venous return? All the blood which is coming back to the right atrium. We have discussed the local control of blood flow. If one hand is exercising, blood flow in that hand will be more. If one arm is exercising, blood flow in that arm will increase. And so the local blood flow is according to the local requirement of the tissues. So all this local blood flow, they are summed up to form the venous return. So sum of all the local blood flow is venous return. So any condition which increases the local blood flow will increase the cardiac output. For example, exercising muscles. When the person is performing exercise, that will increase the blood flow throughout the muscles, and it will increase the venous return, and it will increase the cardiac output. Cardiac output regulation, sum of all the local blood flow regulation. We have discussed the control of the local blood flow, regulation of the local blood flow. All this is contributing toward the control of cardiac output, because local blood flow control is controlling the venous return, and venous return determines the cardiac output. So sum of all the local blood flow regulation is the regulation of cardiac output. Local blood flow is regulated, we have discussed it when we are discussing the local control of the blood flow, regulated by local tissue factors according to the local requirement, local needs and local metabolism. उसके मुताबिक ये सारा होता है. Oxygen demand theory or vasodilator theory or metabolites or other nutrient demand theory, all these factors which are controlling the local blood flow, they affect the venous return, that affects the cardiac output. This, for example, exercise increases the blood flow throughout the exercising muscle, so that will increase that will increase the cardiac output as well as cardiac index. Of course, cardiac index depends upon the cardiac output. So cardiac index with the work output during exercise, if the work output is increasing, cardiac index and cardiac output both are increasing. Cardiac output and cardiac index both are increasing with the more blood flow in the skeletal muscle. Any other condition in which the blood flow is increased, that will increase the cardiac output and cardiac index as well. Now we know the blood pressure is the product of cardiac output and peripheral resistance, total peripheral resistance. Effect of total peripheral resistance on the cardiac output. We have discussed the regulation of blood pressure. Blood pressure is regulated at that equilibrium point, 100 millimeter of mercury, if everything is physiological, everything is normal. So any condition in which total peripheral resistance increases, that will tend to increase the blood pressure. But we have discussed the mechanism. Blood pressure will return to the normal. How? If the peripheral resistance is more, cardiac output will be reduced to maintain the blood pressure. Or if the peripheral resistance is reduced, cardiac output will increase to maintain the normal arterial pressure. So what will be the effect of total peripheral resistance on the cardiac output? Normally, we are going to see several conditions in which peripheral resistance is increased or decreased, but the blood pressure remains normal. इसको हम देखने लगे. We know this equation, that is blood pressure is proportional to this is the blood pressure is proportional to cardiac output and peripheral resistance. इस equation को हम इस तरह भी on the Ohm's law के मुताबिक we know the cardiac output is proportional to the pressure difference. Blood flow, cardiac output, what is cardiac output? Is the blood flow. ब्लड फ्लो कितना ब्लड फ्लो कर रहा है, सिस्टमिक सर्कुलेशन में कितना ब्लड फ्लो कर रहा है, जो ब्लड पंप एट द लेफ्ट वेंट्रिकल एंड रिटर्निंग बैक टू द राइट एट्रियम, होल ऑफ दिस ब्लड फ्लो is venous return, and this is the cardiac output. So blood flow according to Ohm's law, we have discussed it is directly proportional to the pressure difference. Pressure difference हमें पता है कितना होता है, 100 millimeter of mercury at the left ventricle जहाँ से शुरू हो रहा है, and 0 millimeter of mercury at the right atrium. So it is pressure difference is practically the arterial pressure, mean arterial pressure जिसको हम कहते हैं. So cardiac output is proportional to the pressure difference, and it should be inversely proportional to resistance. If the cardiac output is more, if the peripheral resistance is increased, cardiac output is inversely proportional to resistance. अगर resistance blood flow को ज़्यादा हो तो cardiac output should be reduced. ये तो हमें पता है, it is inversely proportional to the peripheral resistance. What? Cardiac output. Cardiac output inversely proportional to resistance. So cardiac output इसी ओम्स लॉ के मुताबिक हमने ये पहले भी कैलकुलेट किया हुआ है. We have calculated it. Cardiac output will be equal to arterial pressure minus right atrial blood pressure. This is the pressure difference divided by TPR, total peripheral resistance. यही equation है ना Ohm's law की. Ohm's law की pressure difference directly proportional to the pressure difference and inversely proportional to the peripheral resistance. So it is arterial pressure minus right atrial pressure divided by TPR. And practically, जैसे अभी मान कहा, this is 100 millimeter mercury, this is 0. So practically arterial pressure is sufficient. So practically cardiac output is equal to arterial pressure divided by TPR, inversely proportional to TPR. तो कार्डिक आउटपुट इज इनवर्सली प्रोपोर्शनल टू टीपीआर. इसी को हम आगे देखेंगे. If the TPR is more, cardiac output should be less. If the TPR is less, cardiac output should be more. It is inversely proportional. यही हमने आगे देखना है आज. So effect of TPR on cardiac output, ये diagram. These are different conditions. Very efficient, hyperthyroidism and anemia. These 4 conditions. Very vitamin deficiency disease in which the peripheral resistance remains only about 40%, 42%, 45% only. Normal peripheral resistance is 1 PRU, it will be 0.4 PRU or 0.42 PRU. And very there is severe vasodilatation throughout the body and resistance is very low. But the blood pressure, if we see, this line is showing us the blood pressure. This line is showing, this black line is the blood pressure. Blood pressure in very patient is 100 millimeter of mercury. It is 100 millimeter. How? Cardiac output is here. When the peripheral resistance, this line is the total peripheral resistance, this is 100%. This is normal peripheral resistance, 1 PRU. This is 0.8 PRU, 80%, and 0.6 PRU, 60%. And here, very 0.45, 0.43 or 1.45 PRU is the very resistant. But the blood pressure is there. Why? Cardiac output is here. When the peripheral resistance is reduced, cardiac output has increased to maintain the normal arterial pressure. So, cardiac output is inversely proportional to peripheral resistance in a normal person. Otherwise, normal. Very vasodilatation hui hai. If there is heavy shunt, if there is some shunt between a bigger vessel artery and bigger veins, then the resistant vessel are bypassed. वो bypass हो गया तो total peripheral resistance will be less. AV shunts में it is 50% total peripheral resistance, but the blood pressure remains normal because of the high cardiac output. Resistance has reduced, but the cardiac output, this red curve is showing us the cardiac output. This is cardiac output curve. Cardiac output will be high, though the resistance is only 50%, but the blood pressure is maintained at 100 millimeter of mercury. In hyperthyroidism, there is throughout the body there is increased metabolism and vasodilatation. Metabolism की वजह से vasodilators are produced, and there are vasodilators, carbon dioxide, lactic acid, other metabolites. They cause the vasodilatation, and vasodilatation reduces the peripheral resistance to only 60%. In hyperthyroidism 60% कह ले, अंदाजा कर लें, and but the blood pressure remains normal because of the high cardiac output. So hyperthyroidism में cardiac output is more, resistance is less. Anemia में there is resistance is less. When there is anemia, the resistance to the flow, blood is diluted. And diluted blood, viscosity of the blood is less, so easy flow, that is resistance is reduced. In anemia it is 70% or something like that, but the blood pressure in anemia is 100 millimeter of mercury and cardiac output is more. So these 4 conditions in which the resistance is less than 100%, less than normal, cardiac output has increased to maintain the arterial pressure. And opposite we dekh le, that is, this is normal, that is when the resistance is 100% normal, cardiac output is also 100%, and arterial pressure is also 100 millimeter of mercury. And these are the 2 conditions written here, that is when the resistance has increased, removal of the that is both limbs को हटा दिया, the resistance has reduced. हमने बहुत सब वेसल खत्म कर दिए हैं, उधर का रेजिस्टेंस खत्म हो गया, तो रेजिस्टेंस हैज रिड्यूस बट द ब्लड प्रेशर रिमेन देयर बिकॉज़ द कार्डियक आउटपुट हैज रेजिस्टेंस यहाँ पे 140% आ गया, एंड द कार्डियक आउटपुट हैज रिड्यूस टू मेंटेन द आर्टेरियल प्रेशर. arterial pressure को in condition में removal of the limbs has increased the peripheral resistance, but the cardiac output has reduced to maintain the arterial pressure. And this is the hypothyroidism. Hyperthyroidism में resistance is very low. In hypothyroidism, resistance is 60% increase, and the cardiac output has reduced to maintain. So whenever there is increased peripheral resistance, one statement that is cardiac output is inversely proportional to the peripheral resistance. If the peripheral resistance is less, cardiac output will be more. If the peripheral resistance is more, cardiac output will be less to maintain the normal arterial pressure. Maintenance of normal arterial pressure is very effective mechanism. We have discussed all 7, 8, 9 mechanism we have discussed. So metabolic limits of the heart, this is the physical activity of the heart. Heart pumps all the venous return. ये तो हमने Frank Starling mechanism पढ़ा हुआ है. But there is a limit within physiological limits. Heart is going to pump all the venous return. Frank Starling mechanism, cardiac output increases proportionate to venous return. ये तो हमने समझ. जितना cardiac output है उतना, जितना venous return है उतना ही cardiac output है. इसको हम एक और तरीके से देख सकते हैं. We can see this another angle. More the venous return, more will be the right atrial pressure. Normal right atrial pressure is 0 millimeter of mercury. If the venous return increases, right atrial pressure is going to increase. So when venous return increases, right atrial pressure increases and cardiac output will increases. So we will plot, now we are going to plot cardiac output against this right atrial pressure. Normal cardiac output, again, normal right atrial pressure is 0 millimeter of mercury and normal cardiac output is 5 liters per minute. If the right atrial pressure increases, how it can increase? When the venous return increases. So if the right atrial pressure is 1 millimeter of mercury, cardiac output kitna hoga? We are going to see in that graph. So we are going to plot this in next graph. So cardiac output increases when the right atrial pressure increases. Right atrial pressure is proportional to venous return. Abhi humne discuss kiya. So normal heart rate normal heart rate can increase cardiac output. Heart can increase cardiac output up to 13 liters. क्या मतलब? If the venous return is increasing without any stimulation, without any nervous system involvement, without involvement of the nervous system, there is the normal simple pumping effectiveness of the heart is capable of increasing the cardiac output up to 13 liters. Yani 13 liters tak venous return ho jaye, heart will be able to pump. This is the metabolic limit. So simply by Frank Starling mechanism, simply by the properties of the cardiac muscle, this can increase up to 13 liters. When the effectiveness of the heart as a pump, when the hyper effective heart, when heart is more powerful pump, for example with the nervous activity or with the hypertrophy of the heart, it can increase in a normal person up to 25 liters. That is hyper effective heart. We are going to see what are the conditions in which the heart becomes hyper effective pump. So in hyper effective heart, it may be 25 liters per minute. And in hypoeffective heart, if there is something wrong with the heart, then this will be very low. Jitni zyada kharabi hogi heart ki. So we are going to see the condition in which the normal cardiac output will increase with the hyper effectiveness of the heart, or it will decrease with the hypo effectiveness of the heart. This is, we are plotting cardiac output against the right atrial pressure. Normal right atrial pressure is 0 millimeter of mercury. This green curve is the normal curve. That is, at 0 millimeter of mercury, cardiac output will be 5 liter. Cardiac output will be 5 liter. इसको वापस जाके मैं समझाऊं. At 0 millimeter of mercury, cardiac output will be 5 liter. If the venous return increases, it is 2 millimeter of mercury, between 0 and 2 millimeter of mercury, it will be about 10 liter. At 4 millimeter of mercury, it will be about 13 liters. This is 15, about 13 liters, and after that there is no further increase. This is the simply Frank Starling mechanism. It is the simply the properties of cardiac muscle which can which can pump all the venous return up to 13 liters. 13 लीटर तक अगर बढ़ जाए, heart will be able to pump with the increasing right atrial pressure up to 4 millimeter. This is metabolic limit. इसके बाद further increase is not possible. Heart cannot generate more force. This is Frank Starling's mechanism, is the generation of more powerful power by the heart, contraction of the heart, increasing heart rate, etc. जो we have seen पहली स्लाइडों में देख के आ गए. So this is the simply Frank Starling's mechanism. This is the hyper-effective heart. For example, if the heart muscle mass has increased, or if we have stimulated the sympathetic system, then at the 0 millimeter of mercury, this is the agar maximum stimulation at 0 millimeter of mercury, it will be 10 liter. Blue curve को देख लें, या ये dotted curve को देख लें. At 0 millimeter of mercury, it will be 10 millimeter of mercury. तो ये मैक्सिमम स्टिमुलेशन है, दैट इज दी हाइपर इफेक्टिव हार्ट. फॉर एग्जांपल सिंपैथेटिक स्टिमुलेशन में कह रहा हूँ, हार्ट रेट विल इंक्रीज, फोर्स ऑफ द कंट्रैक्शन विल इंक्रीज, एंड एट 0 millimeter of mercury सिंपैथेटिक स्टिमुलेशन पे कार्डियक आउटपुट में भी 10-12 लीटर. ब्लू लाइन पे करके देख ले. एट 4 millimeter of mercury इट विल बी 25 अगेन. नॉर्मल हार्ट से सिर्फ हार्ट को छोड़ेंगे, 13 लीटर कैन पंप, एंड विद द हाइपर इफेक्टिवनेस ऑफ द हार्ट सिंपैथेटिक स्टिमुलेशन की वजह से इट कैन गो अप टू 25 लीटर्स इन अ नॉर्मल पर्सन. ये नॉर्मल पर्सन के एथलीट्स में इससे भी ज्यादा होता है, बिकॉज हाइपर दिस इज सिंपैथेटिक स्टिमुलेशन. हाइपर इफेक्टिवनेस हियर इज अचीव्ड इन दिस नॉर्मल पर्सन बाय सिंपली सिंपैथेटिक स्टिमुलेशन, एंड इट हैज गॉन टू दिस लेवल. But in well-trained athletes, marathon runners, footballers, the cardiac output may increase up to 30 liters, up to 35 liters. So this is the hyper-effectiveness and hypo-effectiveness. We are going to see the cardiac failure. Heart is not pumping forcefully, or the ischemic heart disease or valvular disease. When the pumping effectiveness is reduced, then the cardiac output 0 millimeter of mercury it will be not 5 liter, it will be less. Ye the lower curves we are going to see. Sorry. So hyper effectiveness कैसे हो सकती है? Nervous stimulation, sympathetic stimulation we can easily go through. We know the effect of the nervous system, sympathetic system stimulation increases the heart rate. It will increase the cardiac output. Heart rate may be 180 to 200 beats per minute. Increase sympathetic stimulation increases the force of the contraction. It will increase the cardiac output. And parasympathetic inhibition will increase the hyper effectiveness. Heart rate will be increased, and force of contraction will also increase with the inhibition of the vagus nerve, parasympathetic nerve, and this is hyper effectiveness of the heart will be produced. More powerful pumping effectiveness will increase in sympathetic stimulation and parasympathetic inhibition. So maximum nervous excitation may increase the cardiac output up to 25 liter. जो पिछली डायग्राम में हम देखे, that blue curve 25 liter तक pumping effectiveness can be achieved. Hyper effectiveness, hypertrophy of the heart, marathon runners, athletes, that is the 50 to 70% increase in the heart muscle mass. Hypertrophy of the heart occurs in the marathon runners or athletes or the footballers or heavy exercise करने वाले लोग जो हैं, athletes में heart is increased, heart mass, muscle mass is increased 50% up to 70%, and may occur in a marathon runners, and this will increase the cardiac output. Pumping effectiveness of the heart, 60 to 100% increase in the pumping effectiveness will be achieved. So more pumping, that is the combined nervous excitation and hypertrophy may increase the cardiac output in these people up to 6 to 8 times. 6 times means 6 5s are 30, 8 times means 8 5s are 40. So 30 to 40 liters of the blood may be pumped in these athletes, and with the sympathetic stimulation, with the hypertrophy of the heart. So hyper effective heart. Inhibition of the opposite हम बात करें, If the sympathetic system is inhibited, heart will be hypoeffective. Or if there is coronary artery disease, hypoeffectiveness, हार्ट में खराबी, hypoeffective की hypereffective पहले देख के आ गया, hypoeffective pumping ability has been reduced, so cardiac output will be reduced in all these conditions. So arrhythmias, if the heart rhythm is not there, then the pumping effectiveness is also reduced. We have discussed in the different arrhythmia, the pumping effective failure, person can go into failure. So valvular heart disease, this is again the pump नहीं काम करेगा, valve नहीं काम करेगा तो. So the severe hypertension, blood pressure is very high and heart cannot force the blood against this very high pressure. And the congenital heart disease is different conditions, and the myocarditis, inflammation of the heart, all these conditions will reduce the pumping effectiveness of the heart, and the cardiac output will be less at the different levels of the right atrial pressure. No, nervous control, nervous system is important to keep the arterial pressure normal by adjusting cardiac output according to the requirement. We have discussed the regulation of this blood pressure. It is nervous system is involved for the maintenance of the normal blood pressure. If this is experiment, we are going to demonstrate the effectiveness of the nervous system for the control of cardiac output and for the control of blood pressure. पहले भी हमने discuss किया हुआ है. DNP, dinitrophenol, is a drug which increases the metabolism throughout the body. ये एक ऐसी ड्रग है which can increase the metabolism throughout the body. Thyroxine, for example, another. Thyroxine also increase the hyperthyroidism. हमने अभी slide देखी थी ना. Hyperthyroidism में generalized increase in the metabolism. This is an experimentally. We give DNP to any animal to increase the metabolism throughout the body, and we will observe the effect on the blood pressure and cardiac output. With the nervous system intact and without nervous system. We are going to observe the role of nervous system in the regulation of cardiac output, nervous control of cardiac output. Generalized vasodilatation will occur if the metabolism increased, and if the nervous system is intact, autonomic nervous system, sympathetic and parasympathetic. Autonomic nervous system is intact, that is the increase the cardiac output to maintain the blood pressure. This vasodilatation should reduce the blood pressure, but blood pressure does not reduce if the nervous system is all right. If it is intact, this cardiac output will increase. Resistance has fallen, but the cardiac output will increase to maintain the arterial pressure. And without autonomic nervous system, if we block the autonomic nervous system, we will observe this DNP increasing causing the vasodilatation will reduce the arterial pressure, cardiac output will not increase, and the blood pressure will fall. ये हम diagram में देखें. This is a diagram. दोनों को खोल लेता हूं मैं. This red line is administration of DNP with intact nervous system. This is red line is the pressure control. Pressure remains normal, but the resistance has decreased. Without pressure system na hota, blood pressure would have fallen like this. And cardiac output होकर आगे देखें dinitrophenol देने में cardiac output, if the dinitrophenol intact, this is with pressure control system, nervous system intact, cardiac output will increase, and but if the nervous system is not intact, the cardiac output will fall. So this is the importance of nervous system. Nervous system adjusts the cardiac output to maintain the arterial pressure. If the TPR is reduced, cardiac output will increase. If the TPR is increased, then the cardiac output will be reduced. Exercise and ANS control that we have talked about is it is understandable अब तक की discussion के बाद, that is vigorous contraction of the muscle will cause increased metabolism, and it will increase the oxygen utilization and the nutrient supply, and vasodilatation will occur, and there will be demand for the oxygen and the vasodilator, etc. But the TPR is reduced in all these conditions because of the exercise, danger of fall in the blood pressure, but the nervous system is intact and the blood pressure, sympathetic nervous system is stimulated and the cardiac output is increased and vasoconstriction occurs and the blood pressure does not fall. वरना एक्सरसाइज ने ब्लड प्रेशर को फॉल कर देना था बिकॉज ऑफ द कार्बन डाइऑक्साइड मेटाबोलाइट्स एटसेट्रा मोर ब्लड फ्लो टू blood pressure should fall vasodilation occur throughout the muscle but the sympathetic system maintains the cardiac output and maintains the blood pressure so increase BP to supply the more blood to exercising muscle उस वक्त तो ज्यादा cardiac output चाहिए नाउ वी आर फिर लिस्ट करते हैं ये कंडीशन पहले भी हाई कार्डियक आउटपुट कंडीशन वो जो हमने लिस्ट की थी शुरू में उनको एक्सप्लेनेशन यहाँ पे मैंने जल्दी स्लाइडिंग गुजारूंगा वी हैव डिस्कस्ड एनी कंडीशन इन विच द chronically reduced TPR वो कौन सी बेरी hyperthyroidism anemia वो viscosity of the blood etc हमने देखी थी all those condition in which there is chronically reduced TPR cardiac output should be more ये देखें बेरी विटामिन बी थायमिन डेफिशिएंसी जिसको हम कहते हैं डिक्रीज एबिलिटी टू यूज द न्यूट्रिएंट्स सो देयर विल बी वेसोडाइलेशन सो कंपनसेटरी वेसोडाइलेशन विल अकर फॉर द मोर ब्लड फ्लो एंड टीपीआर इज रिड्यूस कार्डियक आउटपुट विल बी मोर हमने डायग्राम में देखा हुआ लॉन्ग टर्म वीनस रिटर्न इंक्रीज करके इसको कार्डियक आउटपुट विल बी इंक्रीज टीपीआर कम हुआ कार्डियक आउटपुट इंक्रीज करके ब्लड प्रेशर इज मेंटेन कार्डियक आउटपुट इज हाई इनवर्सली प्रोपोर्शनल टू रिड्यूस टीपीआर ये बात करके आ गए हैं नाउ क्रॉनिकली रिड्यूस टीपीआर कौन सी कंडीशन फिस्टुला हमने देखा था उसमें कनेक्शन बिटवीन द मेजर आर्टरी एंड बिग वेसल एंड ब्लड फ्लो डायरेक्टली फ्रॉम द आर्टरी टू द वेन एंड टीपीआर टोटल परipheral रेजिस्टेंस इज लेस एंड कार्डियक आउटपुट विल इंक्रीज इनवर्सली प्रोपोर्शनल टू दिस लॉन्ग टर्म venous return will increase and it will increase the cardiac output so TPR is less cardiac output will be more or again the chronically reduced TPR another condition hyperthyroidism throughout the body there is vasodilatation metabolism is more oxygen is utilized and concentration is less vasodilator etc vasodilatation throughout the body TPR is less but the cardiac output will be more 30 to 40% increase in the cardiac output will occur so chronically reduced TPR anemia we have this ये हम पहले डायग्राम देख के आ गए that's why I am going faster in these slides anemia में decreased oxygen carrying capacity viscosity is also reduced so the reduced oxygen causes vasodilatation and there is less TPR total peripheral resistance is reduced so cardiac output will be more in all these conditions and chronically reduced TPR pulmonary diseases when oxygen supply jab na ho that will also cause the decreased oxygen carried to the tissue and more less oxygen and more carbon dioxide accumulation etc and it will cause vasodilatation and TPR is less TPR jab bhi kam hoga cardiac output will be more it will be increased chronically reduced TPR pregnancy mein there is another central circulation which blood is going so there is a reduced TPR and blood flow cardiac output increase blood volume is also increase metabolism and increase oxygen consumption decrease oxygen concentration mother का oxygen उधर भी जा रही है fetus में जा रही है so vasodilators are there metabolism हो रहा है and TPR in pregnancy is also reduced so cardiac output and is also reduced to maintain the blood pressure so cardiac output in different ये वही condition आ गई है that is the very that is the cardiac output will be here by the resistance is less and the efficiency में cardiac output will be more and hyperthyroidism में cardiac output will be more and these are the condition before this in which TPR is reduced and these are the condition in which TPR is increased and cardiac output is less and to maintain the arterial pressure तो कार्डियक कंडीशन वही कर्व है दो कर्व हम पहले देखिए दैट कार्डियक आउटपुट कर्व यूं ही आ रही थी ये वही कर्व है बार डायग्राम में दिखाई गई है वही डायग्राम है जो पहले हम देख के आ गए ऑलमोस्ट वही डायग्राम है स्लो कार्डियक आउटपुट कंडीशन ये भी हम देख चुके हैं if something is wrong with the heart central causes of the low cardiac output condition central causes and peripheral causes cardiac output की कम होने की causes क्या हैं low cardiac output condition central causes में क्या हो सकता है causing leading to decreased pumping effectiveness of the heart वो CAD and arrhythmia and valvular disease etc जो heart की condition है वो प्रॉपर पंप ना कर रहे हो, लो कार्डियक आउटपुट विल बी देयर। पेरिफेरल काजेज में क्या हो सकता है? काजेज लीडिंग टू डिक्रीज वीनस रिटर्न, ब्लड वॉल्यूम कम हो जाए, ब्लीडिंग हो जाए एटसेट्रा, या कोई वेन ब्लॉक हो जाए एटसेट्रा, काजेज लीडिंग टू डिक्रीज वीनस रिटर्न, दैट विल इंक्रीज दी डिक्रीज द कार्डियक आउटपुट। लो कार्डियक आउटपुट, कार्डियक काजेज में हमने पहले गिने हुए हैं, मायोकार्डियल इन्फॉक्शन सीएडी जिसको कहते हैं, वेल्वुलर डिजीज, मायोकार्डाइटिस, कार्डियक टेम्पोनेट, ये भी हम नेक्स्ट लेक्चर में भी बात करेंगे। व्हेन द फ्लूइड इज अराउंड द हार्ट, कार्डियक टेम्पोनेट उसको कहते हैं। व्हेन पेरिकार्डियल सैक में फ्लूइड भर जाए उसको कहते हैं कार्डियक टेम्पोनेट, वो पंपिंग इफेक्टिवनेस को मुश्किल में बना देता है, तो कार्डियक टेम्पोनेट में पंपिंग इफेक्टिवनेस इज रिड्यूस। ऑल ऑफ दीज कंडीशन लीड टू डिक्रीज पंपिंग एबिलिटी ऑफ द हार्ट एंड कार्डियक आउटपुट विल बी रिड्यूस। एंड लो कार्डियक आउटपुट कंडीशन में पेरिफेरल काजेज में जो ब्लड वॉल्यूम कम हो जाए या एक्यूट वेजोडाइलेटेशन हो जाए, एक्यूट वेजोडाइलेटेशन, ऑब्स्ट्रक्शन टू अ लार्ज वेन, वीनस रिटर्न कम हो जाएगा, एंड डिक्रीज टिश्यू मास स्पेशली स्केलेटल मसल कम हो जाए, तो द वीनस रिटर्न विल बी रिड्यूस एंड पंपिंग इफेक्टिवनेस विल बी रिड्यूस। पेरिफेरल काजेज में और कौन? डिक्रीज ब्लड वॉल्यूम, हेमरेज, decrease filling of the vascular tree with the blood, pressure, decrease pressure to push the blood, ये इस कंडीशन में ब्लड वॉल्यूम जब कम हो जाएगा, ये कल हम डिटेल में डिस्कस करेंगे। वॉल्यूम जब कम होगा ब्लड का तो उसमें क्या इफेक्ट होगा, वीनस रिटर्न क्यों कम होता है, जैसे दी प्रेशर कम होगा, वीनस रिटर्न जब भी कम होगा, ब्लड वॉल्यूम कम होगा तो वीनस रिटर्न तो कम होगा, सीधी सी बात है, कार्डियक आउटपुट विल बी रिड्यूस्ड, कार्डियक शॉक विल अकर। तो पेरिफेरल काजेज में और अक्यूट वेजोडाइलेटेशन जैसे आपने पढ़ा हुआ है प्रोबेबली, दैट इज एनाफिलेक्टिक शॉक, वेजोडाइलेटेशन, हिस्टामिन शॉक, acute vasodilatation due to the acute sympathetic inhibition, vasodilators like in anaphylaxis and relative reduced blood volume etc, filling of the vessel will reduce and venous return and cardiac output both will be reduced, shock will occur। Another peripheral cause में और क्या, obstruction to a large vein, ये भी of course you can calculate, large vein जब बंद हो जाए तो venous return will be reduced due to the thromboembolism and blood flow to the heart will be reduced and decreased venous return and cardiac output will be reduced। तो शॉक विल अकर इन ऑल कंडीशन, ये नीचे शॉक लिखा हुआ है, शॉक में हम डिटेल लेक्चर लेंगे इनकी वजह से जो शॉक होता है, व्हाट इज शॉक, शॉक को हमने डिफाइन नहीं किया हुआ, शॉक को हम डिस्कस करेंगे इंशाल्लाह। तो पेरिफेरल काजेज में और डिक्रीज टिश्यू मास स्पेशली स्केलेटल मसल, बूढ़े लोगों में जैसे स्केलेटल मसल वीक हो जाते हैं, टिश्यू मास इज रिड्यूस्ड एंड टोटल ऑक्सीजन कंजम्पशन इज रिड्यूस्ड, सो दैट विल रिड्यूस द ब्लड फ्लो, ब्लड फ्लो हर जगह, because the cardiac output or venous return is equal to the all the local blood flow, sum of the local blood flow, जब मास कम हो जाएगा तो local blood flow भी कम होगा, तो venous return is going to be reduced, तो decrease venous return will reduce the cardiac output and shock may occur। ये भी वही condition, low condition, all those condition in which there is the pumping effectiveness of the heart, peripheral causes or central causes is reduced blood, उसमें resistance बढ़ के उसको ठीक करेगा, cardiac output is reduced in these conditions। So इसको we will continue this discussion in next lecture as well, and a lot of detail about the venous return and the, what are the pressure which are responsible for the increasing or decreasing venous return, वो भी हम देखेंगे next lecture। next lecture में हमारा cardiac output part 2 हम next lecture में discuss करेंगे। Hope you are following me। If you have got some question आप पूछ सकते हैं comments में, और फिर वही आखिर में रिक्वेस्ट वही है कि इस मेरे चैनल को सब्सक्राइब भी करें और लोगों के साथ शेयर करें ताकि इसकी इफ़ेक्टिवनेस बढ़ सके, लोगों तक ये बात पहुंच सके। थैंक यू वेरी मच।